Dr. Giampapa, can you tell us what's new in the world of stem cells and how they're being used?
Well, stem cells are about to revolutionize medicine and what we've been doing. The science behind this is just so fascinating and so tremendous in its impact on what's going to happen with medicine in general. Stem cells are right now being used in 3,000 clinical trials throughout the world for things like diabetes, things like Alzheimer's disease, reconstructive purposes, as well as many other things. But as usual, these new technologies tend to be utilized more quickly and more easily with cosmetic applications. So although they're not the fountain of youth yet, they're very promising to what we're going to be able to do with both external rejuvenation of the face as well as internally with the body. So without a question, stem cells will be what the computer industry was to medicine in the next 4 or 5 years. The near future is here now. In fact, from a preventative point of view, we are now collecting and storing people's stem cells even at the early age of the mid-20s. It's these cells, when we store them now, whether we're young or old, are then there for any emergency that we might have, a disease process we're not aware of. So frankly, we're already in the process of using these things for regenerative purposes. For instance, these cells have already been used in clinical trials to grow new blood vessels instead of open heart surgery. They've been used and already been shown to be dramatically effective in restoring cartilage in worn joints. And as you know, we're using these dramatically in wound healing, in cosmetic applications, and the use will only expand dramatically. Every 4 months, the amount of information we have in stem cells doubles.
Can you tell us the difference between a standard facelift and a stem cell facelift?
Well, you know, facelifts, the actual procedure of stretching and pulling the skin began over hundreds of years ago. And up until recently, up until the advent of stem cell technology, nothing's really changed. We may have changed the technique a little bit, or what muscle we tightened, or what we did. But what we didn't do is restore a natural contour to the face that also improved the quality of the skin. And with the aging process, it is not just a loss of the facial shape as we get older, but also the quality of the skin. So this is really the first time we're able to utilize the body's own regenerative powers to restore both the facial shape as well as the quality of the skin. And what we do differently is we make no incisions, and the technique is performed under local anesthesia as opposed to a general anesthesia. And usually in an hour or a little bit more, we can start the process of rejuvenating the face and then allow the power of these regenerative cells to take hold and actually see an improvement month to month, and now year to year. We've actually followed people up for almost 6 years. And what we see is not only a maintenance of this more youthful look, but an improvement, an ongoing improvement in the quality of the skin. So right now, the opportunity for people to take advantage of what we call bioinsurance really relates to this whole new concept of collecting and storing your cells so that they're there for not only a disease process that might develop or a trauma, but so that you're available, those cells are available to meet the curve of new information that is just doubling every 4 months.
So what would you recommend to the average person? What action should we take now?
Well, there are certain things you can do to help keep not only your body cells, but your stem cells in good health so that they can replace these worn out and dying or aging cells. A lot of that has to do with your diet, your exercise, and a whole host of other things that people can find out very easily on the internet. But more importantly, the concept here is to think about, rather than life insurance, which doesn't do you any good, is to really think about what we call this bioinsurance. Really think about collecting, storing those cells so that you are in a position to take advantage of what will be a revolution in medicine over the next 5 to 7 years.
I understand your office has a facility to do just that. Can you tell us some?
Yeah, we're the only office in New Jersey that is a certified blood bank and licensed to collect and store stem cells. And we make that an integral part, or an option, if you will, of people who want to not only look good, but age optimally. In the very near future, we will be using those cells and giving them back to our patients to help restore and regenerate their liver, their heart, their pancreas, because all of those things tend to get less optimal as we age. So the secret is to store those cells that actually replace all these worn out and non-functioning cells. Collection and storage is one of the best new options we have in preventive medicine.
I've noticed there are a lot of doctors, plastic surgeons these days who are saying they do stem cell facelifts. How is your procedure different?
Well, our procedure, or my procedure, is very different in the fact that right now we use the fat cells with the stem cells that are contained right next to them. So when we collect the combination of this cell complex, we then mix it with specific growth factors. And these are factors that are really information sources and tell the cells what to grow into. And some of these growth factors take these stem cells and have them grow into new fat. And some of the other growth factors have them grow into new skin elements. So this is a revolutionary concept in that we need to not just restore volume, but we need to restore the quality of the skin. So that was unique. And the other thing that's quite unique with this is the growth factors that we use are strictly unique to this procedure. They are a patented process that, frankly, at the moment, no one else has access to. So that makes this a very, very unique thing. The other things that we do as well, we prepare the body for the procedure. We actually have people utilize certain non-prescription compounds that help release stem cells from their bone marrow. So circulating in their body are more of their natural stem cells that actually get called to the area by these growth factors in the procedure itself to help rejuvenate the face as well. So it's a dual approach. It's actually utilizing the body's reserves as well as transplanting with these information growth factors.
Okay. I've noticed there are a lot of products these days that say they contain stem cells or they're enhanced by stem cells. How effective are they?
Well, you know, there's a lot of new products coming out in the market that are made from, quotes, stem cell growth factors.
Okay.
Some of those products are from apples. Some of them are from sheep. Some of these are actually from human cells. All in all, each one of these things, I think, are allowing the skin industry to take a quantum leap forward in improving skin quality. Most importantly, the cells that would be the best for anyone are your own cells. So what we do is allow those transplanted cells, once they're underneath your skin, to secrete and create the compounds that you need naturally to restore your skin. We also do use a little topical compound with people on an ongoing basis that actually helps the skin turn over quicker and repairs damage to the DNA, which is what makes those stem cells work even better.
Fantastic.